What would the American healthcare system look like if it were like Germany's? First, the cost of your healthcare would be based on your income. Imagine a system where a federal agency, like the U.S. Department of Health and Human Services, oversaw federal healthcare regulations. Employees and employers would contribute about 7.5% of the employee's income to public health insurance programs. However, this would be capped at $500 a month per employee. For that premium, your family members are covered, your non-working spouses, your children, and you do not have to pay any additional premium. Then, depending on your state, your contributions might be adjusted slightly just to account for regional healthcare needs. And these costs would be deducted directly from your paycheck, just like how Social Security is today. Then you would select your insurer from a group of non-profit insurance companies. Think of it like selecting an insurance provider like United Healthcare or Blue Cross Blue Shield, except for you have over 100 nonprofit companies to choose from. All of these insurers are required to provide the same core benefits. They only compete on supplementary things like wellness programs, customer service, and optional supplemental benefits. You would get your insurance card and then you would need to go find a doctor, but this wouldn't depend on your network. You would have the freedom to choose any doctor that participates in the Nationalized Healthcare Program, which is the majority of doctors. Then you would make and attend your appointment without having to worry about out-of-pocket expenses because co-pays, deductibles, and those types of things are not at the center of the system. If you were prescribed a medication, you would take that down to the pharmacy and you would pay a maximum of 10 euros out of pocket. If you needed a specialist, your primary care doctor would refer you, much how referrals work in the HMO system today. Anything resulting from the care of that specialist would also be covered. Now, there are exceptions like cosmetic procedures or those that are not medically necessary, but those are established from national guidelines that all insurers must follow. Some things do have a small fee associated with them. For example, you have to pay 10 euros per day for your hospital room, but that's capped annually. Out-of-pocket expenses for anything cannot exceed 2% of your income, or 1% if you have a chronic issue. Finally, vision and dental would also be partially covered, with basic procedures being covered under public plans. Advanced care does require some out-of-pocket expenses. This is similar to what currently happens in the United States with the employer-sponsored plans. If you lost your job, you wouldn't have to worry about losing your health care. The federal agencies would step in to pay for your contributions during that time to make sure that there were no gaps in coverage. And in addition to this statutory system, private insurance companies would also exist. High-income earners or self-employed people have access to private insurers that provide customized plans. These private insurers resemble much of what it looks like in the United States today. Premiums are based on factors like risk instead of income, and this makes them more expensive, but potentially more flexible. It's certainly not perfect, but what do you think?